City coroner's offices are quickly getting overrun. We've seen big refrigerator trucks move in and out of this facility in East Flatbush all day, and the bodies are coming from places like this community, hard-hit neighborhoods of color that have felt they haven't gotten the resources through this pandemic. Now there's concern not even everyone who dies is being counted.
I believe that we are giving a false count of actually how many people are dying due to coronavirus.
The data that's out there is bad. And so I imagine when we get the full amount of information we need, it's going to be even worse.
During a joint digital press conference, Public Advocate Jumaane Williams and Brooklyn Borough President Eric Adams continued to call for more resources and a racial breakdown of who's dying during the pandemic. Based on this map, we already know the hardest hit zip codes are neighborhoods predominantly occupied by people of color and immigrants. Many continue to work in places like grocery stores and as bus drivers instead of being able to stay at home. Now there's increasing evidence that some are dying in their homes without making it to the hospital and are not even being counted due to a lack of testing.
Some says, well, don't play the race card. No, the card is already played when you look at the map.
The state and city have said gathering racial data is not easy because hospitals don't report the information and coroner's offices around the state have to be called manually. But today the state did promise to get racial information out later this week and pointed to one reason why people are dying in greater number in low-income neighborhoods.
They're more apt to have some of the challenges with asthma and diabetes, and so anytime anyone who has underlying medical conditions ends up with this virus or any other virus, it puts them more at risk.
CUNY epidemiologist Dr. Dennis Nash says an accurate count is important, not just to make sure we're getting a handle on the current crisis, but to make sure history doesn't repeat itself during the inevitable next time.
This can be done with or without testing. Ideally, it would be based on testing, but it may unfortunately sometimes have to happen without testing. But there needs to be a determination of the likely cause of death.
We will continue to press the city and state for racial information and make sure everyone is accounted for during the pandemic. In East Flatbush, Henry Rossoff, Pix 11 News.